Question number 1. Involuntary urine loss associated with the over-distension of bladder is option A. Urge incontinence, option B. Stress incontinence, option C. Reflex incontinence, option D. Overflow incontinence. Answer option D. Overflow incontinence. Rational. Overflow incontinence is defined as involuntary urine loss with over-distension of the bladder. Urge incontinence occurs randomly when involuntary urination is preceded by the warning of a few seconds to a few minutes. Stress incontinence is an involuntary loss of urine that occurs without detrusor contraction when intravesical pressure exceeds urethral pressure. Reflex incontinence is periodic involuntary urination without any warning or stress. Question number 2. A postoperative patient has developed urinary retention. To relieve the patient from retention, the nurse carries out all of the following except option A. Place the patient in a sitting position. Option B. Place a hot water bottle over the perineum. Option C. Get an order for inserting a catheter into bladder. Option D. Administer a diuretic. Answer option D. Administer a diuretic. Rational. In urinary retention, bladder is distended with urine, but the patient is unable to pass. Diuretic will further increase the discomfort by producing more urine and distending the bladder. Placing the patient in sitting position often help by increasing intra-abdominal pressure. Warm hot water bottle may promote muscle relaxation. In persistent retention, the nurse need to insert a catheter into the bladder, but this requires an order from the physician. Question number 3. The physician has ordered bladder catheterization for a post-operative patient with persistent urinary retention. Which of the following catheters she should use? Option A. Plain catheter. Option B. Foley's or indwelling catheter. Option C. Three-wave catheter. Option D. Any of the above. Answer option A. Plain catheter. Rational. Postoperative urinary retention is usually a temporary problem. So, plain catheter for single use is adequate to relieve retention. Foley's or indwelling catheter remain in bladder for longer time for longer term problems. Three-way catheter is used to bladder irrigation. Example, after resection of prostate. Question number 4. The most common intrarenal cause of acute renal failure ARF is option A. Acute glomerulonephritis, option B. Renal thrombosis, option C. Acute tubular necrosis, option D. Septic shock. Answer option C. Acute tubular necrosis. Rational. Acute tubular necrosis is the most common intrarenal cause of ARF and accounts for about 74% of cases. Acute glomerulonephritis and renal thrombosis are the less common causes. Septic shock giving rise to decreased peripheral resistance is one of the pre-renal causes of ARF. Question number 5. A patient with chronic renal failure has developed uremic amaurosis. Uremic amaurosis is the option A. Diminution of the deep tendon reflexes. Option B. Progressive hearing loss. Option C. Sudden onset of bilateral permanent blindness. Option D. Sudden onset of bilateral temporary blindness. Answer option D. Sudden onset of bilateral temporary blindness. Rational. Uremic amaurosis is a sudden onset of bilateral blindness which seems to be reversed in hours to days. Diminution of deep tendon reflexes, progressive hearing loss, or sudden onset of bilateral permanent blindness is not termed as uremic amaurosis.